Now, the Molosankwe Foundation and Mahikeng Cycling Charity Club will resume a 3,044-kilometer cycle marathon from Mahikeng to Cape Town. The event is to raise funds for children with cancer and comes after an 11-year-old Mahikeng girl was diagnosed with cancer of the eye when she was 4 years old. Her left eye was badly affected and had to be removed. Our reporter Bafedile Moerane is there for us and joins us now. Bafedile, very good morning to you. An interesting story, one of course that pulls the heartstrings of many. What is expected to happen there today?
Well, as you say, Mpho, it's quite a long journey, and all, to seek better health for the children living with cancer. So this after Spekinini, it's actually her nickname, was identified here in Lomanyeneng in Mahikeng, and she has been diagnosed with cancer from the age of 4. And we understand that it has actually been quite a battle since Charlotte Maxeke Hospital was closed down after the fire, and she has actually been receiving treatment from that particular hospital. But since that incident happened, she's no longer getting treatment anywhere else. So hence we see the Molosankwe Foundation taking this particular initiative to raise funds, in particular for children living with cancer and children living with terminal illnesses. So I'm going to talk to Tato Molosankwe here to talk to us about this particular initiative, what exactly is expected, because he's intending to raise 5 million rand for this particular children. Molosankwe, thank you so much for joining us. Let's get the context as to, because now we are 20 kilometers away from Mahikeng. You are intending to go to Cape Town. You will be going through Gauteng province and Bloemfontein, among others. What exactly? Give us the context. What are you intending to do? How are you going to engage people? How are you intending to get funds from people of this country?
Yes, let me take this opportunity to greet viewers at home and listeners. Say beginning Gold Ride childhood cancer awareness. It's inspired by a 11-year-old beautiful young girl from underdeveloped community, from underprivileged family, whereby you see children living with terminal illnesses because only their parents are poor. They are left to suffer and to die a brutal death. So we must not allow that as the community. It is very important that we act, we take a responsibility. We don't just point a finger at a government, but we must raise funds to save children. Therefore, speaking in currently, her left eye was badly affected by cancer, and it was removed when she was only 4 years old. I'm hoping that by the time I complete this course, that is going to take me 30 days, covering 3,044 kilometers. Speaking in would have an artificial eye. And since Charlotte Maxeke was affected by fire, many children were left without help. This course is intended to call on government to say open access in private hospitals for all children living with cancer, other terminal illnesses, and disability, so that they get quality treatment and quality health care. We are going to make sure with the money raised, we are trying to raise 5 million. That money will go towards organizations that will adopt this program of childhood cancer, so that they educate communities to encourage communities, parents, to take children for treatment, so that cancer can be, what is the word? It can be identified at an early stage, so that it can be cured. So as I will be riding across different towns and cities across 5 provinces. I will be conscientizing people, making people aware about this cancer in children. This theme is gold. You can see I'll be cycling in gold. Gold ribbon represent a childhood cancer. I would appreciate it during the course of this cycle of cycling over 30 days. People can just get gold ribbons, and they can go to Back a Body. Back a Body is assisting us to raise the 5 million that will assist these children. People can also go to our Facebook page. It's called Spekenini Gold Ride Childhood Cancer Awareness, whereby people can just press at the link and donate whatever they can afford. There's a map there. There's a Google map as well, whereby people can track me every day, and my entire route map is there. So I'm saying to our people, in the name of Nelson Mandela, remember Nelson Mandela built a hospital so that it can cater children affected by fire. Therefore, these children don't have to pay. We need to have such a hospital locally. I mean, look at our province, but I have hope in our current premier, Bushi Mape. I'm calling on him, I'm calling on Ntate Sambata and Arts and Culture Department of Health to rally behind this cause so that we can better our clinics. We have our hospital. We have Tusong Hospital. ANC found it in good conditions, and Mahikeng Provincial Hospital. Let us have all these services. Children don't have to travel so long to get services.
Well, thank you so much, Tato. As you hear him there contextualizing as to what exactly is expected to happen in this ride, in this cycling to Cape Town, it's 3,044 kilometers. So he's hoping to raise 5 million for this particular children who are affected by cancer. They has called on government to also come forward, and anyone in this particular country to donate, in particular trying to assist unprivileged children who are affected by terminal diseases and cancer.
Some seriously concerning words and sentiments raised there. Bafedile Moerane really giving us some insight on a really important part that we may have forgotten, of course, and the impact of that fire on many lives. We will continue to keep track of that story.